I think the situation is much better now, but I have to say something about this. I think that the COVID-19 is a common enemy of the human being. Owing to its high reproductive index, it's impossible to be well under control. So if COVID-19 remains spreading by any of the countries in the world, so that's the point. We need to have to join together. So to end this spreading in the world, any decisive action taken by the policymakers must be based on science and evidence and the best clinical trials in dealing with the public health problem, just like dealing with the climate, just like dealing with the air pollution. We're the same goal to deal with that. So the cooperation and together is very, very important. In regard to the how to get it, I think the best ways under the coordination of the WHO will be the best to have the better and equitable allocation of the vaccine, in particular to those countries who cannot afford.
In my mind, I mean, I would underscore everything that Professor Zhong said, but also something that is going to require a multi-year, decades commitment, and that is to make and strive for essentially access to quality health care for everyone in the world, so that health is really a human right in many respects, and that we should work, and it's going to require a lot of economic improvement in certain countries. It's going to require essentially a commitment as a global community to make sure that there's accessible health care no matter where you are, and building up the healthcare infrastructure, even in countries that don't have very much healthcare infrastructure now. We have a very good example of success in the delivery of healthcare that was associated with the PEPFAR program, when people said you'd never be able to get medications for the prevention, treatment, and care of HIV in the developing world. And PEPFAR and the Global Fund has proven that to be incorrect with the extraordinary advances. I think we can do that with all aspects of health. So my great hope is that as the months and years and decades go by, we keep going in the right direction of more and more accessible, easy to get to healthcare for every citizen of the world.